Welcome to This Explainer. Today, we're jumping right into a chronological look at a defining event of our modern era, the COVID-19 pandemic in the United States. We're going to take a step back from those daily headlines we all remember so well and look at the macro-level scope of this historic crisis. By tracing the hard data and the historical timeline, we can really begin to grasp the sheer scale of what happened, how the nation responded, and how this virus fundamentally altered American society.
But to truly ground ourselves in the reality of this event, we really have to start right here with this staggering number, 1,238,563. That is the number of confirmed American deaths attributed to COVID-19. Seeing it laid out like that makes the unprecedented scale of this disaster completely tangible. I mean, it's a number that actually surpasses the casualties of major global conflicts. It stands as this stark reminder of the virus's immense human cost. Keeping this figure in the back of our minds is going to give the rest of our timeline the gravity it absolutely requires.
So here is the roadmap for our explainer today. First up, the virus arrives. Second, escalation and emergency. Third, societal impacts. Fourth, variants and vaccines. And finally, the devastating toll. All right, part one. The virus arrives. The quiet escalation. Okay, let's dive into this. Before it became a nationwide emergency, it was this quiet, almost invisible escalation. It was slowly crossing borders and moving into communities long before public health systems could fully detect it. And the timeline of those early days moved incredibly fast. On December 31st, 2019, China publicly reported a cluster of pneumonia cases in Wuhan. Fast forward just a few weeks to January 20th, 2020, and the very first case of COVID-19 was reported on American soil. The U.S. government then officially declared a public health emergency on January 31st. But the virus was already moving way faster than our testing infrastructure. By February 6th, the first known American death with COVID-19 occurred in Santa Clara County, California, which is a pretty stark indicator that the virus had actually been circulating undetected in communities for weeks. Moving on to part two, escalation and emergency, the spring of 2020. That quiet spread, well, it abruptly transformed into a full-blown nationwide crisis. Just look at how condensed this timeline is. It brilliantly illustrates the dramatic velocity of the spread. On March 13th, a national emergency was declared. Exactly 2 weeks later, on March 27th, the U.S. surpassed 100,000 cases. By April 11th, the country recorded its 20,000th death, tragically surpassing Italy to become the nation with the highest death toll in the entire world. And just before that month ended, on April 28th, the U.S. shattered the 1 million case milestone. The sheer speed of this transmission was fundamentally threatening to overload the entire healthcare system. So, in response to this massive existential threat to hospital capacity, we saw sweeping state and local interventions implemented nationwide. These unprecedented public health responses included things like stay-at-home orders, broad mask mandates in public spaces, the sudden closure of schools across the country, and the immediate cancellation of basically all large-scale gatherings, festivals, sporting events, the whole shebang. The main goal of these sweeping society-wide actions was simply to slow down that terrifying velocity we just looked at, all in an effort to prevent our medical infrastructure from total collapse. Which brings us to part three, societal impacts, disparities, and divisions. Now, what's really important to note here is that the virus didn't affect everyone equally. The objective data shows a highly disproportionate toll. If we look at the drop in life expectancy from 2019 to 2020, we see a very stark contrast. While white Americans experienced a 1.2-year drop, African Americans saw a 2.9-year decrease, and Hispanic and Latino Americans experienced a severe 3.0-year drop in life expectancy. This data directly maps out how the burden of the disease was carried far, far more heavily by Black and Latino populations. And alongside these severe health disparities, some really serious societal fractures started to emerge. The public health crisis was shadowed by a documented sharp increase in incidents of xenophobia and racism directed at Asian Americans. Furthermore, this whole pandemic environment just became a breeding ground for widespread misinformation and conspiracy theories. So what started as a medical emergency was quickly compounding into a highly complex social crisis as well. All right, part four, variants and vaccines, the medical arms race. By late 2020, the scientific community was pushing back hard. It basically turned into this chronological tug of war. In December 2020, the very first vaccines became available under emergency use, kicking off a truly historic national vaccination program. But as we know, the virus mutated. By March 2021, the highly transmissible Alpha variant was surging, which was later followed by the even more infectious Delta variant. We saw the first full FDA vaccine approval in August of 2021. Yet, by January 2022, the Omicron variant had arrived, driving an astonishing 1.5 million new infections in a single day. It was just this constant, high-stakes battle between medical science and viral evolution.
But throughout this incredible arms race, the data on medical interventions became glaringly clear. CDC findings contrasted the outcomes incredibly starkly. Compared to fully vaccinated individuals, those who were unvaccinated were anywhere from 5 to nearly 30 times more likely to be infected or hospitalized. And this stark disparity in outcomes, that is exactly what drove the subsequent and severe strain placed on hospital capacities throughout the country, as facilities were just repeatedly pushed to their absolute limits.
And finally, Part 5, the devastating toll, looking back at the numbers. Looking back at all these phases, it's absolutely crucial to reflect on the ultimate, inescapable statistics of this era. Check out the shocking disruption to American mortality here. In the year 2020, a completely novel virus abruptly became the third leading cause of death in the United States, sitting just behind heart disease and cancer. Think about that for a second. A pathogen that was entirely unknown to science just months prior had completely reorganized the leading causes of mortality in the country. And in terms of the pure scale of infection, the confirmed case count reached an unbelievable 103,436,829. By the end of 2022, the CDC estimated that 77.5% of all Americans had been infected with the virus at least once. It literally touched nearly every single family, workplace, and community across the nation.
So the crucial takeaway here is captured perfectly by this sobering historical fact. The COVID-19 pandemic ranks as the deadliest disaster in the country's history, period. It even surpassed the casualties of the 1918 influenza pandemic, becoming this incredibly grim benchmark in the American historical record.
We've looked at the rapid timeline, those staggering numbers, the medical arms race, and the deeply disproportionate societal impact. We've seen exactly how vulnerabilities in the public health system were brutally exposed. So I want to leave you with this final thought. With these staggering losses now permanently part of our history, how will the hard lessons we learned from COVID-19 shape our preparation for the inevitable next global crisis? Thank you so much for joining me for this explainer, and I really hope this structured look at the data gives you a clearer, broader understanding of this historic event.